moving on. Okay, have you guys ever heard of somebody named Paige DeSorbo?
No.
Does that name ring a bell, Trey?
No, it does not.
Okay, I wasn't familiar either. But of course, there's so many people out there that are notable, it's hard to keep track of everyone. So Paige DeSorbo is a model, journalist, TV personality. She's been on a reality show called Summer House. I missed that one. I'm sure it's awesome. I do kind of like reality shows a little bit, so there was a chance I may have seen that one, but had not. But she was recently in the news, because apparently she is kind of a notable person, because she was on the Giggly Squad podcast talking about her fear of breast implant rejection. She really wants to get a breast augmentation, but she has this deep-seated fear that if she gets breast implants, that her body will reject it. And just on a side note, which is kind of interesting, on that podcast, because I watched a little clip of it, they were talking about, you guys remember Denise Richards, the actress? Yeah. Mm-hmm. She was kind of famous like 10, 20 years ago. I think she still does stuff. So apparently last year, she was doing I think it was for some show. She jumped off a bridge with some sort of harness on her, and allegedly it ruptured both of her breast implants whenever, like, I guess the harness caught her. Yeah, that's pretty unusual. I may have to look that up. That would be very unusual to me because, we've done so many torture tests on implants. They're very resistant to blunt trauma. Mm-hmm. I was surprised to hear that even with something that jarring, that they would rupture. It almost makes you wonder if maybe she had contracture or something that would, make it more likely to happen. But just total side note on that. But going back to Paige DeSorbo, she said that she really wanted to have a breast augmentation, but she was convinced that her body would reject the implants. And so, have you guys heard of that? Like, you've heard people talk about it? Yeah. You hear about that from time to time, breast implant rejection. And so I want to talk about that topic because although it's not something you hear a lot about, you do see it from time to time. And really kind of just cutting to the chase, there's not really any documented rejection of breast implants in the classic sense of, being allergic to the material.
Okay.
Because when I think of like rejection, I think of either like, like an organ transplant getting rejected, like your body's attacking it because it sees it as a threat, or it's some sort of allergy, an allergic reaction. And really that's not a real thing. There's not such thing as a breast implant rejection. However, there are things that can happen that might make a person think that their body was rejecting it. And so I kind of want to go over that because, we're kind of splitting words here because, if you have lots of problems, could you say your body's rejecting the implant? Yeah, you could say that. At this point, it's semantics. I think of rejection as like a true, allergy where everything goes smoothly with the surgery. There's no complication, but then your body attacks the implant or something bad happens. Yeah. Like I guess it depends on how you think of the word rejection. I think of rejection more in that type of sense.
It's like if you're just not healing correctly, some
right.
people
Yeah,
can think that.
Like any surgery, breast augmentation surgery can have complications and. There's a saying in surgery, and I say it from time to time, that, sometimes one complication begats another, which, obviously means that, you have one complication, and then that causes another complication, and then you get in this cascade of things going wrong, and that certainly can seem like maybe your body is rejecting, your decision or the implant or whatever. In fact, one of the patients I've had, that was kind of a sad story is this was many years ago. I did a breast augmentation on a lady, and postoperatively she had bleeding. Well, that's really rare, but it does happen. They say it's about a 1% risk of bleeding, and you're not going to bleed to death inside your breast, but if you bleed, you need to get that blood out of there. So we took her back to surgery and washed out the blood, closed her up, everything looked great. Well, the side where she had the bleeding then got scarring, and it's like, oh, okay, well. The other side was perfectly fine, but the side that bled suddenly got this bad scarring internally, so I had to go back and released all that scar. And then it came back again, not not as bad, but it still came back. And
Yeah,
it's
it's
just
like a healing issue.
yeah, it was just like the first problem caused a second problem, and then fixing the second problem resulted in a third problem. And so, was she rejecting her implant? No, I mean, she had one on the other side that was completely normal, and everything was fantastic. So I think when people, talk, you'll hear people every once in a while, like blog or on social media, and say, oh, my body rejected my implants or whatever. It's probably just an issue of, you had a complication, or maybe there was some bad decisions made, not necessarily by the patient, or could be the doctor. Like I went with, you went with really enormous implants, and then your incision broke down, and you're messing with that, and then you get an infection, and then suddenly you get scarring, and it's like there's just this cascade of bad outcomes, and the end result is somebody saying, oh, well, my body rejected the implant. Is that really real? No, it's not.
Yeah, definitely sounds like healing issues.
Yeah, it's like healing issues or just complications in general. I mean, there's a reason that the implants are made out of silicone. I mean, almost not all, but a lot of medical devices are made out of silicone. There's a reason for that choice, is that it's a pretty inert substance. Your body doesn't really react to it, and there's not really, I mean, I haven't seen any documented true allergies to silicone, So I think that when people talk about implants getting rejected, more likely if you dug into what happened, it was either, bad decisions made resulted in complications, which resulted in more complications, or just bad luck resulted in a complication, which resulted in more complications.
Yeah.
And then eventually people are like, you know what, I'm just gonna take these out. Obviously, they're not for me. I mean, it happens. I mean,
Is that what happened to the lady that you did all the
I don't know.
scarring
She
work?
actually left. Like, I mean, I get it. Like, she had some problems, and she's just like, I'm gonna, get a second opinion or whatever. And I mean, I totally understand that. I mean, I see tons of patients that got surgery elsewhere that come to me for second opinions, and every once in a while it happens to you, where just something happens and people have a complication and they just want to get another opinion. So she ended up not staying with me, which makes me sad. I mean, it's like, oh, I failed. But yeah, I don't know if she ended up keeping them or not. I don't know. She, obviously we were like, no, we'll see you through to the end here. But she's like, no, I'm going somewhere else, which is a bummer. So anyway, I don't really think that there's any truth to that, the reject, and there's not really any data to support that. But I do want to talk about, what are the complications of wrist breast augmentation surgery? I know we've talked about these from time to time, but I think it definitely is pertinent to this conversation. So for me, number one risk is capsular contracture. I know we've talked about this on the show before. Basically, capsular contracture is where the layer that forms around your implant gets too tight and too hard. It's just basically an overreaction to the healing process. And, it can be brought on by complications like the patient I was talking about that got a bleed and then got a contracture. I mean, that all makes sense because the breast got really inflamed because of the bleeding, and then she got scarring. You can see it when people get infections. Infections are very, very, very rare. So bleeding and infection, which are kind of the two big risks for surgery in general, fortunately are very, very rare with this type of elective surgery, like less than 1% risk. I've only actually had, in all the 15 years I've been doing cosmetic implants, I've only had one get infected.
Okay.
Which is a pretty insanely low number. I'm pretty meticulous about how I put in my implants, which I think, obviously helps.
Yeah.
As far as like your outcomes. Bleeding's a little bit more prevalent. I mean, I've had a few augs bleed over the years. A handful, like I'd say less than 5 in 15 years.
Like, what does that mean when you say bleed? Because it's like whenever I think
like post-op
surgery.
bleeding, like enough bleeding that like one side swells up.
Oh, okay.
Yeah, post-op bleeding. I mean, nobody's bleeding when you close them up. I mean, or you wouldn't close them up. It's like a week later, 2 weeks later. I had one lady bleed 3 weeks later.
Okay.
A lot of times it can be patient dependent, especially with augmentation. You have to be careful because this is a surgery where you're going to feel like back to normal in a few days.
Yeah.
And then so where
You're
people
supposed
get,
to.
huh?
You're supposed to.
Ideally, yeah.
Yeah.
At least, most of my patients within 2 or 3 days, they feel back to normal for the most part. And so what'll happen is you kind of forget, oh, I just had surgery. You're really not supposed to exercise or lift anything heavy for at least a month.
Yeah.
And so I've had patients get in trouble like 2 or 3 weeks out because they forget, and then they, unload a 50-pound bag of dog food out of the back of their car, and it strains their upper body, and then they get a bleed.
Oh my goodness.
Yeah, that can happen. So anyway, capsular contracture, that's your number one risk. The stated risk is around 10% nationwide. It should be less than that for people who do lots of implants. I think ours is around 3%, which is pretty good, but still, it's not zero. Bleeding infection should be very low. Sensory changes, people can get numbness from these. Implant malposition, that's like a really rare complication where the implant gets out of position. That's why when you get an augmentation, the doctor's gonna be very strict about wear your sports bra for a month, 2 months, or whatever.
Yeah.
Because what ends up happening is that capsule layer which forms, ends up locking that implant in place so it can't get out of position.
I remember after I had mine, I had to wear this like band.
Yeah, I don't know why people do the bands. Like, I've never understood that. Like, it makes no sense. I don't know what they're trying to do with the band.
I don't know.
Like, I don't think really that many people do that anymore. I mean, not anyone I know does that.
Yeah.
Nowadays, most people just say, wear a sports bra. It's just support things. The band to me never made sense. It's like maybe they're trying to decrease swelling. I don't know.
Maybe. I don't know.
You had to wear it up top. It was on top.
Mm-hmm.
Yeah, it's probably for swelling.
Yeah, Trey, you got the
remember
buy.
After I got them done, I felt like my peripheral, like I felt like I had like my face.
Well, because what ends up happening is,
I felt like they were
the
just
implants kind of prevent swelling at the bottom, and so all the swelling comes up top.
Yeah.
And that's why you'll hear people talk about implants settling. That's not a real thing. Like, your implants don't settle. Like, your implants don't go anywhere. You don't want them to go anywhere because you put them right where they're supposed to be. But what happens is with the swelling up top, as the swelling comes down, it looks like the implants are settling. That's a complete misnomer or, I don't know, fabrication. That doesn't really happen. Healing issues along the incision, that's pretty rare. That's usually from bad decision making, like really big implants in a really small person. And then just aesthetic issues, maybe the size isn't what they want or the shape doesn't look right. A lot of that's just talking to the patient, and making sure they understand or making sure you're on the same page as far as picking size. And if there are differences in shape from one breast to the other, making sure patients know that. Because augmentation doesn't fix things like one breast being in a different position or one nipple being lower. And so I spend a lot of time talking to patients about, okay, this is what it's going to change and this is what it's not going to change.
Yeah.
So that when you get to the other side of it, that there's no surprises. And the other thing too that should be stated as a risk, which we haven't talked about in forever, is that breast implant illness. I haven't heard about that for a long time.
That's really just like a
It kind of like was almost,
thing.
I don't want to say it was a fad, but 5 years ago, you heard about it quite a bit. And I haven't heard anything about it recently. There's definitely no like research to show that there's any link to the.
Well, I feel like a couple of years ago, I feel like it was just like taboo to get plastic surgery, and now it's like, yeah, get your filler, get your Botox, like it, like when people tried to like hide it.
Yeah.
But now
it is funny how cyclical. And I think now we're back into a time of, we were just talking about this a couple months ago, like nowadays more people want plastic surgery that no one else knows they've had. The invisible plastic surgery, or what they call it.
For sure, but I don't think it's like, I think people know so much about it now because of the information.
Yeah, social media is just,
Yeah, so it's like you can tell like when somebody's had Botox, you can tell when somebody's had lip filler. Like you can tell if you know how, like what to search and like all that stuff. It's like.
Yeah, I agree. Like, if you're really savvy, you can pick it out. But once again, I think, what I think is really the best work is the work that no one knows you've had done. It's possible to get things done and get a change, but it not be noticeable. But that's a fine line,
Yeah.
You have to toe that line between getting a good result, but getting a good result that's not obvious.
Yeah, like mine.
Huh?
Like my Botox.
Yeah. How do you like your Botox?
It's good.
It's good.
Yeah.
Like it. Good.
You did it. You're like,
know
I
we
like
did it. Did we just do it like a week ago? A couple weeks?
No, like 2 weeks ago. You were sick last week.
Oh, right.
remember?
Yeah, I was sick last week.
I hope you don't.
Yeah.
I hope you didn't give me Botox. Being all
it was. That
being
was.
all
I think
delirious.
we did your Botox week before I got sick.
Yeah.
Yeah.